This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right, in this day and age, we've been dealing with lots of people who are protesting, right? Because there's a lot of things that are going on that society is fighting against. And one of the things that happens when you have protests is sometimes you get violence, and with violence you get tear gas or pepper spray. And so when people get pepper sprayed, a lot of times they end up in your department. The question is, well, what do you do with someone who's been pepper sprayed to the face or to the body? The biggest thing is, first, get them completely derobed, right? So any of the irritant, you want to remove it. So immediately remove the clothing that could have the irritant on it and do a full rinse. Not with soapy water, because that can actually make things worse. And one of the things that you can use actually to help with skin related issues is a half and half mixture of milk of magnesia and water. And so if you get a patient coming in, they're super uncomfortable, specifically, especially if it's a kid that comes in who's angry and agitated, get half milk of magnesia, half water, and you just pretty much douse them with it, right? And clean that off. That will help with soothing of the skin and neutralizing that pepper spray. And what do you do for the eyes? So, for adults, we can do Proparacaine, then you put a Morgan lens in and you just flush that eye out, right? With kids, it's a little more difficult. And so one thing you can do to help with a kid is, yes, you could put Proparacaine or tetracaine in, drop to help them with the pain, and then you can rig a nasal cannula up to a liter bag of saline or a 500cc bag of saline. So what you do is you pop the saline and then you connect the end of the nasal cannula to it, and then you just set the nasal cannula right on the nose. You can plug one side if it's just one eye, or if it's both eyes, you just set it here and you just let it run. And so the kids will hopefully not be uncomfortable once you put the Proparacaine or tetracaine drops in, and then it slowly runs in and they don't have someone trying to push things in their eye, which is what really can freak them out. So the big things to take away is milk of magnesia and water, and then you can use Morgan lens for adults with tetracaine or Proparacaine, and then the nasal cannula piece for kids.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.